Now, as Nigeria and the world at large continues to search for solutions to the ravaging COVID-19, government at all levels have been fingered to introduce policies that will further improve the health sector, with rumors making the rounds that some very essential and critical drugs ranging from antibiotics, painkillers and among others are about to be banned from being imported into the country. A coalition of civil society organizations at a press conference on the pharma drugs crisis in Nigeria alleged that the position of government and the CBN is a fraud aimed at creating a monopoly to high cost of drugs to enrich a few. On the global pandemic, the speakers say government is completely ill-prepared to handle the rampage in COVID-19. The group says government must have a rethink and redress the challenges in the health sector by putting an end to foreign tourism by political elites, proper funding of healthcare across the three tiers of government, and formation of policies to drive availability and affordability of essential drugs for the teeming populace.
Decrepit and in the state of great anomaly is an understatement. Nigeria is rated as one of the worst places on earth to be an infant, a child, or a mother. Perhaps the biggest testimonies of the near-death situation of our healthcare system are: 1, the shameful and continuous resort to foreign medical tourism by our political leaders to access better healthcare infrastructure in other countries. Fortunately, the coronavirus has played a very cruel joke on our leaders and has forced them to remain with us to confront a common challenge that faces everybody.
Every single government policy is aimed at killing the next Nigerian who cannot afford to go abroad for treatment. I do not know the reason why NAFDAC came up with a policy that for all drugs to be imported into Nigeria, you must bring them to Lagos. A number of drugs come to the seaport in Lagos and they expire because of the congestion in Lagos.
Where life of an infant, of a neonate, and a mother is at stake. That's the worst country where such people can stay. So we're advocating, we're asking that NAFDAC, with whatever silly policies they are putting, should have a human face, so that everybody, not just the mother, not just the child, our husbands, our children, everybody in the country should survive. And surviving, that the drugs should be made available, should be affordable and accessible.
This is a critical time in the life of the nation. All drugs, essential drugs, ought to be available. We have no choice at all. If these drugs cannot be produced in Nigeria, why can't provision be made for imported drugs to come into the country so that they can be used by numerous Nigerians who are sick, especially at this time that coronavirus is ravaging? So I see no reason why some people may want to lobby the government so that certain drugs, the production of certain drugs, should be prohibited.
Based on what is happening in the country now, we've seen that we are far behind in terms of providing for our people medically. And we must call on government at this point. The government needs to make this drug available, affordable, and effective.